We all want to be healthy, right? Public health is about making sure everyone has a chance to be their healthiest selves. It's not just about going to the doctor when you're sick, it's about preventing illness and promoting well-being for entire communities. Think about clean drinking water, safe workplaces, vaccines that stop outbreaks. These are all public health victories. But it's a big job, and in the United States, it's a team effort. We're talking about different levels of government working together, federal, state, and local. Understanding how this system works is important because it affects all of us. It's about how decisions are made, resources are used, and ultimately, how our communities thrive. Imagine a sports team where everyone has a specific role to play. That's kind of how public health works in the United States. We have this thing called federalism, which means power is shared between the national government and individual states. The federal government sets big-picture goals, like making sure food and medications are safe across the country. States then take those goals and create their own plans based on their specific needs. They might have different rules about restaurant inspections or vaccination requirements. Local health departments are on the ground, doing things like inspecting restaurants, tracking diseases, and running community health programs. Over the years, the roles have shifted a bit, with the federal government taking a more active role, especially in emergencies. Public health isn't just about good intentions. It's about laws, too. These laws give power to government agencies and guide their actions. There are two main types: those that protect the health of the public, like requiring vaccinations for school, and those that protect individual rights, like patient privacy. It's a delicate balance. For example, during an outbreak, health officials might need to isolate someone to stop the spread of a disease, but they also need to respect that person's rights. That's where administrative law comes in. This type of law governs how agencies operate, ensuring they follow fair procedures and don't overstep their boundaries. It's all about accountability and transparency. You've probably heard of some of these agencies: the Centers for Disease Control and Prevention, the Food and Drug Administration. These are the powerhouses of public health. They're responsible for everything from tracking diseases to approving new medications. But they don't work alone. There are also tribal health agencies serving Native American communities and state and local health departments. Each level has its own responsibilities, but they all share information and resources to keep us healthy. Funding for these agencies comes from taxes, and it can fluctuate depending on political priorities. That's why advocating for public health funding is so important. Without enough resources, these agencies can't do their jobs effectively. Let's meet some of the big players on the federal team. The CDC is like the disease detective agency. They track outbreaks, research new health threats, and provide guidance to states and communities. The FDA makes sure our food and medications are safe and effective. They oversee everything from clinical trials to food labeling. Then there's the National Institutes of Health, or NIH, which is actually the largest biomedical research institution in the world. They fund groundbreaking research that leads to new treatments and cures for diseases. These are just a few examples of the many federal agencies working behind the scenes to keep us healthy. While the federal government sets national goals, states and local communities are on the front lines of public health. They know their communities best and tailor their programs accordingly. State health departments might run programs to promote healthy lifestyles, like encouraging physical activity or providing nutrition education. Local health departments are even closer to the ground. They might inspect restaurants, provide immunizations, or offer services like disease screenings. The size and structure of these departments vary widely depending on the state and the community's needs. Public health is a team sport, remember? All levels of government need to work together to be effective. Sometimes that means sharing information during outbreaks. Other times it's about coordinating resources during emergencies. For example, imagine a new virus emerges. The Centers for Disease Control and Prevention would track the outbreak, develop testing guidelines, and provide guidance to states. States would then implement those guidelines, set up testing sites, and work with local health departments to trace contacts and isolate cases. This kind of collaboration is essential, especially as public health threats become more complex and globalized. The United States public health system faces real challenges. One of the biggest is funding. Public health is often underfunded, which can lead to staff shortages, outdated equipment, and an inability to respond effectively to emergencies. Another challenge is workforce shortages. We need trained professionals, epidemiologists, nurses, lab technicians, to keep our communities healthy. And then there's the issue of trust. Public health relies on people trusting the information and guidance provided by experts. Building and maintaining that trust is crucial, especially in an age of misinformation. Despite the challenges, there's hope for the future. By investing in public health infrastructure, the workforce, data systems, and laboratories, we can strengthen our ability to prevent and respond to health threats. We also need to find ways to improve coordination and communication between different levels of government and across different sectors, like healthcare and education. And finally, we need to rebuild trust in public health institutions and experts. That means being transparent, communicating clearly, and engaging with communities in a meaningful way. Understanding how the United States public health system works is the first step towards building a healthier future for all.